All right, welcome back to Healthcare Experiences. I have a wonderful guest here with us today. His name is Dominique Stewart. This guy's like my brother. I mean, we go back, what, 14, 15 years, in the Navy. And, I'm just glad to have him on the Healthcare Experiences show. And we're going to talk about the field of healthcare administration. This is a field that Dominique and I this is what we chose as our career path. And especially when we were young, we used to talk about our goals and where we want to be in life. And, now that we're what I would consider seasoned veterans in this field now, man, our perspective have changed. And so we're here to shed some light on that. And without any further ado, I just want to kind of give a quick introduction. Dominique, he is a healthcare executive, have about 14 years of experience working for large healthcare corporations, starting practices up, managing them, managing large group of physicians as well as support staff. This guy's the real deal. I'm glad to have him on my show. And with that, hey, welcome to the show, brother.
Hey, thank you for having me. Happy to be here. What's going on, bro?
Man, I am doing good. Man, having you on the show really put me at ease, man, because I know I don't have to prepare nothing. I think our conversations just organic. And I'm just excited, man, because a lot of our conversations that we've had in the past, I mean, they've been some really deep, good conversations, which I truly felt that people really need to hear about it. And now that basically doing this YouTube thing for the company, I felt like it was fitting to have you on the show, and for that, for us to kind of start having these conversations. And I'm pretty sure this won't be the last time we have you here too, man. So I'm definitely excited to have you here, man. And
Man, happy to be here.
absolutely. And so I just want to kind of talk about, the field of healthcare administration. I remember, for me, and I definitely want to ask you this, but for me growing up, when I thought of the healthcare field, I just thought either a physician or a nurse. That's all I knew. And I've told this story many times before. I'm sure people is probably tired of hearing this story, but yeah, I remember when I first joined the Navy, and that's when I realized, like, oh, okay, being a hospital corpsman is equivalent to being a medical assistant. But and then eventually I learned about being a surgical tech. So I went through school, and I remember when I first got stationed at Naval Hospital, Jacksonville, Florida, they put me in general surgery. That was probably like one of the first, I guess, um, surgery specialties that they put me in, and and just being new, just kind of looking at the other texts. And I remember hearing the text, they're like, yeah, they're going to, community college, and they're working on the degree to become a nurse. And so at the time, I figured that's a natural progression for me, from being a surgical tech, then going to become a nurse. And I guess we'll kind of see what happens from there. But during that time when they put me in general surgery, I was doing a laparoscopic inguinal hernia repair with Dr. Whittigren, and I'll never forget this. It was just him and I, right? And I was navigating the what trocars and all that stuff,
Mhm.
for him. And he just started a conversation. He said, so you're new here? And I said, yep, I've only been here maybe for like a month at the time. And so he said, okay, good. And he was like, how do you like surgical tech? I said, it's okay, but I told him I didn't see myself doing this for the rest of my life. So then he said, well, what do you want to do? And I said, well, I said, I guess I'll become a nurse, because the rest of the techs, they're going to school to become a nurse. So I figured that's just way for me to go. And then he said, what do you really like? I said, I like business, but I told him I also enjoy the healthcare field too. So then that's when he said, well, you should consider healthcare administration. And I was like, what is that? And he said, well, just think of yourself being, a CEO of a hospital someday. When he said that, it's like a light bulb just went off in my head. I was like, really? He was like, yeah. He was like, the CEO, I mean, he's basically, responsible for the hospital. And in the hospital, there's multiple departments, whether there's radiology, you have the OR, you have occupational health, and you have all these ancillary services or whatnot within the hospitals, and he have leaderships within those departments that have to make sure those departments are being ran. So then I was like, okay. And I remember I went home. That was the first thing I did. I Googled healthcare administration. I started reading it. And that's when I knew that's what I'm going to do. And I never looked back, man. I remember I enrolled to University of Phoenix, got my associates in healthcare administration, then went on to Bellevue University, got my bachelor's, and then eventually you and I, we ended up getting our masters at Webster University, man, and kind of started that career. And so that's what got me into it, man. But I'm just interested from your perspective, man. What got you into the field of healthcare administration?
Same thing actually. They're going back to our days in Jacksonville. It's funny you threw a name out there I haven't heard in years, Dr. Whitaker. I got a funny story with him, man. I'll be brief. We were closing a case and he just broke scrub and looked at me. I was a brand new tech. I think you had left the hospital at this point, but I was a brand new tech, and he broke scrub, and he's looking at me crazy, and I'm like, oh, what's going on? And he was like, you don't know how to close, so he was pissed, and Dr. Whitaker never gets pissed, so
Yeah.
he went scrub back in, and he showed me how to close and sew up. So I remember the next time, we did a case. He broke scrub. I was ready to go, and that is one of the few things I do miss about the military. But
Yeah.
similar to your background, I never knew what a healthcare administrator was. I knew all
Mhm.
the basic, and I don't want to use the word basic, but your doctors, your nurses, all the real superficial job titles in healthcare that we all know about. I knew
Right.
about physical therapy, I knew about CRNAs, but basically just X-ray techs. But that's about the extent of my knowledge. And I was in the OR right there in Jacksonville,
Hmm.
and I really have a business background too, and trying to find
Yeah.
my niche. I realized, okay, I thought I wanted to be a CRNA, but that job does nothing for me. So I was in the OR, and a guy ended up getting processed out of the Navy, and I used to shadow him. He was the equipment manager, the business manager for the OR, and I
Yeah.
would shadow this dude and learn his job, and I was
I
really trying
remember.
to vie for that position. Yeah, man, and the
Yeah.
leadership trying to hold us back a little bit. But what happened was he ended up getting processed out. And man, the way our God works, man, they needed a replacement. And he told him, he was like, the only person who knows how to do this job where it won't be a lot of drop off is Stewart, because he's been training with me. So being
Mhm.
proactive and going against the grain has really been beneficial in my career. So once I got that job, I saw how rewarding it was to not actually touch patients, but still
Yeah.
make such a great impact on patient care. And I knew from there, I wrapped up my bachelor's in business management. I didn't want to be a nurse. I really have a issue with individuals in the healthcare field going into clinical roles for job security and a good salary. That's why
Yeah.
we have a lot of the healthcare challenges we have in this country today, because we have healthcare professionals who their heart is not in it. I, like you, I
Mhm.
loved healthcare. I wanted to keep my hand in it, but I wanted to
Mhm.
find a role that worked for me. And once I got into that, it just took off from there, man. You
Yeah.
you kind of became a mentor for me, and I just started just seeking knowledge from everybody, and I love what being an administrator stands for. So that's how I got into it.
Yeah, for sure. You said something interesting. I think, yeah, some people may get into the clinical aspect of the healthcare field, maybe for the wrong reason. I knew early on for me that clinically it wasn't there. Don't get me wrong. I mean, there were times where I did enjoy it. And honestly, I truly believe if I pursued it, I think it's something I've could have been good at. And I think just like you, whatever we put our mind to, we're going to excel and do our very best. But I knew it's something that it just wasn't for me. I wasn't passionate about it. And I think it's very important to pursue what you are passionate about. And for me, I think being in a leadership role, being able to work with people collaboratively, and again, whether it's mentoring people, but it's running departments, that is where my passion lies. And so that's why I pursue the field of healthcare administration. And I think, and then another thing I wanted to also mention about Dr. Whittaker, and right. So interestingly enough, and actually, I think because were you there in 2016, right?
Hmm.
You were still there. So, when I left the Navy and I joined the reserve, every couple of years or so, I would come back to Jacksonville and do my 2-week annual training. And I was still shocked to see Dr. Whittaker was still there when I came back. And I remember I was in the OR that day. I think it was like the first case in the morning, and it was an inguinal hernia repair. So 10 years later, going back into the OR, in general surgery, doing the same procedure that Dr. Whittaker and I were doing. The only difference, I didn't know it was going to be Dr. Whittaker. So here I am setting up my back table and everything. They brought the patient in, they prepped the patient. Usually I look at the schedule. I didn't even look at the schedule. They just say, hey, you want to do inguinal hernia repair, laparoscopic? I said, yeah, absolutely. I go in there, just start getting ready. And then he walks in. I did a double take. I was like, what? I said, Dr. Whittaker. And then he looked at me. He like, your voice sounds familiar. And then he said, Lumene. I was like, yeah. He was like, what are you doing here? I said, what are you doing here? Because he was like an older guy. So I was
Yeah.
so shocked to see he was still there. But long story short, here we are 10 years later, because the first time it was in '06. And so 10 years later in 2016, it was just him and I. Here I am, just kind of driving for him with the camera and everything. And he's like, so what do you do? And I said, you won't even believe this. I said, I'm a healthcare administrator. I said, 10 years ago, we were doing the same procedure and you told me about healthcare administration. And then I told him how I Googled it and pursued it. And he was shocked. He was like, "Are you
Hmm.
serious?" I was like, "Yeah." I was like, that one conversation that we had is what took me on, on this path. Now, granted, too, right? You mentioned mentors. Anne Marie Knight. She was, I think, at the time of maybe a lieutenant or lieutenant commander at the Naval Hospital Jacksonville. And I got connected with her, and she introduced me to the National Association of Health Service Executives in Jacksonville. So they had a chapter, and then through there I met other healthcare administrators. And so, there's just so many people that I came across as I started my journey onto the healthcare administration field. And they really, impart wisdom upon me. They just really helped me out. And I'll forever be grateful for it. So definitely having mentors, man, um, definitely help me out for sure, and I'm sure for you as well too. All right, well, thank you guys for watching Healthcare Experiences. I'm Rene Lumene, and I'll see you next time.